In this video, I'm going to be demonstrating the insertion of a Foley catheter into a male patient. At this point in time, I have already opened my packet. The events that precede this are the same as with the female, so you've already seen that. We'll wash the perineal area and dry the perineal area and then open the packet. So I've opened my kit. I have donned my purple sterile Barney gloves, and I am now going to go ahead and start my sterile procedure. I've informed my patient that he needs to stay still because I have opened a sterile field in between his legs. Now, when we did female catheter, I didn't use this drape. This is called a fenestrated drape, and I didn't use it because we don't normally use it on females, but we do use it on a male patient. Okay, it's fenestrated because we can see through it. All right, and so what we want to do with this drape is we want to hold it and protect our fingers. We're going to place this on the patient. Now, there are some urologists in Dothan that actually require this drape to be used. So if you ever do a male catheter, you need to use this drape here. Okay, so I'm protecting my hands. Shiny side goes down, all right, and I'm going to step over my patient, and I'm going to just lay the drape over the patient. Doesn't matter if I'm over if the penis is coming through the hole or not, because when I go to contaminate this hand by taking a hold of the patient's penis, I'm going to be able to replace this drape where I need it anyway, okay? Now the rest of the procedure is the same so far. Now remember the differences. Remember the drape for the male. Now I can go ahead and I can take my kit. I can move it up a little ways, remembering that I have a 1-inch border around. Okay, I can take the top off, okay, also being mindful of my 1-inch border, okay, and I can prepare my kit to go ahead and insert this catheter. So once again, and it's a very good habit when you're opening anything up after you take it off your sterile field to go ahead and step back from your field when you're preparing your equipment, okay, and then go ahead and step forward. All right, so now I have my little pouch that I'm going to put my catheter in. I'm going to open up my swab sticks. And I'm going to pull them out and get them ready. I'm going to go ahead and get my catheter out now. Okay, notice once again my catheter is sheathed in a nice doubly protected sterile sheet, okay? This guy's really in here. He has a perforation right there. Look at that. You never know what you're going to find in these kits. All right, that guy, I had to actually take that perforation and tear it. Okay, I want to keep a hold of the plastic in this hand, coil my catheter in this hand, okay? So be real careful, because if this guy jumps out, we could contaminate. All right, now, okay, I'll get rid of that. All right, and I'm going to go ahead and put my little guy in the lubricant so he's nice and protected right here. Now, I'm going to go ahead and grab my sterile water, hook it up here to the port where I'm going to need to inflate. All right. Okay. My little guys have slipped down. I'm going to pull them back out. Now I'm still sterile. I can come back into my kit. I can touch anything I want to in here right now because I'm still sterile. Okay. Now, I'm going to tell my patient that I'm about to take a hold of his private parts so I can clean him. At this time, I'm going to contaminate this left hand. All right, I'm going to reach in my drape here. Okay, I can move it where I need it. I'm going to take a hold of the penis, and I want to hold the penis at a 90-degree angle because that's where that's the path of the urethra into the bladder. Okay, so I'm going to hold it, and of course these mannequins don't exactly go at a 90-degree angle, but on a real human male, they're much more flexible. All right, I'm going to go ahead and take my first swab stick. All right, now this is very important. Besides the drape, besides how I hold the penis, how I clean the penis is obviously very different than the female. Okay, with each swab stick, I'm going to start at the urethral opening, the orifice here, and I'm going to swipe 1, 2, 3, just the glands of the penis. Come across, not over my sterile field, in the trash can. Same thing with swab stick number 2. The same area, the same pattern from the opening I'm going to go 1, 2, 3 down the glands, come across, not over my sterile field, in the trash can. And then with my third swab stick, the very same. 1, 2, 3, and in the trash can. All right, now I'm ready to get my catheter out of its lubricant. Okay, so here's another difference that you're going to see. Okay, I'm going to insert this catheter into my patient. I'm going to say remind my patient that I'm about to put this catheter inside the urethra. All right, and they can go ahead and take a deep breath. All right, and I'm going to keep my fingers of my sterile hand away from the head of the penis. I'm going to insert the catheter. Don't want to let go of it. If I let go of it, it will come out. And I'm going to go all the way to the bifurcation of this catheter, all the way to where the port is, right to here, okay, right to where the Y is. At that point, I'm going to let the penis down gently. I'm not going to drop it because that could cause trauma to the urethra. And I'm going to reach under my sterile hand, just like with the female. I'm going to get my syringe. I'm going to blow up my balloon. Keep a pressure on my plunger or it will come out, and give a little gentle tug until I meet resistance. There we go, right there. I can let go. I can disconnect right here, my balloon, okay, and I'm done with the male, okay. The only other thing I want to show you that's different is if we take this fenestrated drape off, okay. And of course, we would take the catheter, we would hang it to the side of the bed. I would change my gloves, just like with the female, but I just want to show you that we would tape this for the male higher up on the leg because we have a shorter distance of the catheter that's remaining, and so we would want to tape this where the port is, just a little bit higher up. The female we tape a little lower, but a little higher on the leg. Okay, and we would tape it the same exact way as the female, making sure that we tape the tube, the catheter tube first, so that it's taped, and then we would tape to the leg. Okay, so that it's loose, okay, but it's a little bit higher up on the leg. All right, and everything else as far as hanging the bag and everything else that we do is going to be exactly the same as for the female. So this is where we'll stop this demonstration right here.